Hi, I'd like to talk about Dr. Gholami a little bit and the procedure that I had for prostate cancer. I was going to a regular doctor and did a check, and they found a lump on the prostate, and he said, probably should have it checked, and that he had a doctor that he'd recommend, which was Dr. Gholami. So we came and met with Dr. Gholami. Over a couple of months, I did some tests and everything, and we did a biopsy. We thought it might be something, so we did one. Came back negative. So I came back in 6 months, and we checked something, and the PSA numbers were going up a little bit at a time. So we over a period of time we checked again and had another biopsy, which came back positive. So he mentioned that there were a couple of things that we could do for it. You can wait and do that, or there's some things he didn't recommend, like the seeding. That, and he would recommend the Vinci method of removing the prostate. My wife just happened to come in with me that day, and we talked for a couple of minutes, and between the two of us we decided, well, we'll get it taken care of right now, as soon as we can. Dr. Gholami said that we'd get a time to do it, which was actually it was in June of 2011 that we had the procedure done, and there's a recovery period after that. The going into the hospital and all that was the easy part. There's a little time that it took after the recovery. I was home for I think 3 weeks, and just getting used to everything. The hardest thing was just getting up out of bed or out of a chair. Just kind of everything was kind of a little bit sore for a while, but over time things got better. 6 months down the road, I was back to work in 3 weeks, and there's certain things you have to do to take care of yourself for that time, and Dr. Gholami suggested several exercises that worked out real well, and 6 months, by Christmas time, I was up and around and doing just fine. I was doing, getting better every week, so it wasn't, it didn't really take 6 months, but at 6 months you look back and you go, well, that was really pretty easy for what it, for what it could have been. And we come back to see Dr. Gholami every 3 months, and they would check, and the best news you'd get back was it's non-detectable, which is wonderful to hear. We're now on a 6-month program, and last check was non-detectable, and it's a really good feeling to know that we've taken care of it. It can't come back. There's nothing there. You don't. There's no more biopsies. You don't have to do all that. But it was overall a very good experience I had. Dr. Gholami, personally, it's interesting to come and talk with him. It's fun, sort of, to talk with him. Very, very modern. Everything's on the computer. He comes, so all the files are there. There's no big paper files that come along. It's all very up to date. It's really good to see. He can get his files right away. And the staff is, from the people at the front desk to everyone else, is just first rate. I would recommend, if anybody needed anything, any services that Dr. Gholami offers, I would be the first to say he would be the man to do it. Very happy, very glad. I know my wife is, that we've taken care of this. So if I could recommend Dr. Gholami to you, or any of his services, I certainly would. So it's Thank you.